when we talk about the gut, sometimes it's complex with regards to that. And what Justin is talking about is this histamine bucket. And the concept, it's not just histamines, it's any kind of stressors that are on the gut, right? So whether or not it's a histamine, or it's fungus, or it's bacterial exposures, or even parasitics, right? All these things can play a part in terms of increasing our gut's ability to deal with histamine, or the histamine load that's within the body. And then, of course, the downstream effects of that is if we don't get those things kind of cleared out and cleaned out and rebuild the gut, right? We've got to remove some of the things that are causing that in the first place, because some of it is just, for a lot of people that I deal with, and probably you too, Justin, is really lifestyle. Right? A lot of
100%.
histamine issues starts with lifestyle. What are you eating? What are you communicating to your gut? What are you communicating to your body? And histamine is where we're at now in this conversation, but how did it get to histamine? That's the question, right?
And the big thing that you're going to see increase histamine, like I talked about the different antigens in the environment, right? Molds, pollens, internal mycotoxin molds in the home. Remember, you have molds, but then you have mycotoxins, which are produced by molds.
Mm-hmm.
Mycotoxins are the off-gassing or the flatulence of molds. Not all molds have mycotoxins. So like molds outside, you may have cladosporium or microsporium from like natural plant decay. But then your drywall that's had water run on it from the leaky pipe, that may be producing Aspergillus fusarium or penicillium, which then produce different ochratoxin, aflatoxin molds that are actual mycotoxins, right? And so we have to look at it holistically. But when we're inflamed, right, when we have lots of inflammation in our body, it could be gluten, it could be too much processed sugar, it could be exercising too hard, not sleeping enough, it could be having very low progesterone because you're estrogen dominant as a female, or low cortisol as a guy, or overly high, right? That's going to stimulate our mast cells, right? Our mast cells are essentially basophils in the bloodstream. When they go into the tissue, they become mast cells. Mast cells produce histamine. So the more inflamed we are, that stimulates immune activation, mast cell activation. Histamine then will come from those mast cells / basophils. That will increase the blood vessel permeability. It opens things up. So it's when you're inflamed, it's common to hold on to fluid. If you think about maybe you got whacked in the eye or bumped your elbow, it gets swollen. Histamine is part of that vasodilation, fluid retention type of reaction. You're going to get cytokines. You're going to get TNF alpha. You're going to get nuclear factor kappa beta. You're going to get different interleukins. These are chemical signals due to the inflammation process that those signals try to help bring white blood cells to clean up the inflammation. The problem is if it's acute, it makes sense. I bumped my elbow. It's good that we get some immune response there to heal it up. But when it's chronic, now you have this low-grade chronic immune activation. So when your immune system's more active and chronic, guess what happens? Now autoimmunity can happen. Now you're attacking tissue. Now, because your immune system's so heightened and you're eating foods, now food allergies are more likely to happen as well. So the gluten, the dairy, the processed foods, maybe the nuts or seeds or eggs, quote unquote, healthy foods could even now be an immune activation. And then we have this leaky gut that now happens because of it. Now our gut's more permeable. And now all that outside world that's coming into our digestive system, now our immune system is interacting with it more closely. So the more our immune system activates with these foods that are not broken down in a peptide or broken down like form, there's more likely to be an immune response to it.
Yeah, that sort of comes back again to that gut health and dysbiosis that we're talking about. So the leaky gut, or the imbalanced gut bacteria, or SIBO kind of things, and then obviously that reduction of DAO enzyme production inside of the gut. But yeah, I think mold having a big correlation, again, just another stressor in terms of like what's going on inside of the body. And so, I think it's, bringing up sort of the mast cell activation. Seemingly a lot more people have become more aware of that and what that's doing inside of them and their body. And this chronic exposure to mold, along with the increased histamine activity, like keeps the inflammation high, right? And that contributes to all of these other symptoms that oftentimes we have. So the fatigue or the brain fog or the poor immune resilience, that creates sort of this feedback loop where the body just remains on alert, right? And it starts to drain all of our resources, and we start to, really spiral down from a chronic low grade perspective, going from one phase of illness to another. And then finally, maybe you get autoimmune, maybe you get some kind of a metabolic issue, right? So when we look at chronic level diseases, autoimmune, cancers, right? Diabetes, high blood pressure, all these different kinds of things that we get as we continue to sort of degrade our body in these ways.
And it's a vicious cycle, right? Because you have inflammation from your food, your lifestyle, your diet, and then that creates more histamine. And then more histamine creates more inflammation. and then it's this vicious cycle.
It's a
And then
cycle.
of course, then now you're sensitive to more foods, and then you see Dr. J and Rob's video on probiotics, and maybe you start eating more probiotics, and then you're like, crap, I'm feeling worse. What the heck? And then you're
Yeah,
like,
you
I don't
feel
know what to
better.
do, right? I'm trying to
Yeah.
make an effort, and then everything's just more sensitive. It's kind of like if you go and you have back pain, right? You have joint issues, but you get a sunburn and you need an adjustment. You need a massage, but now your tissues can't handle it because they're so sensitive. But you don't know what to do, but you want to do something, and then you kind of get paralyzed, right? And that's where a lot of people sit. I've been doing this 15 years, 5,000 plus patients. You've been seeing patients for years as well. Is there any patient stories that kind of come to mind for you where you've seen people struggle with any of these things?
Well, I think what I find with a lot of people is they just felt like they've done everything and can't get better,
Hmm.
right? Like
Hmm.
they feel like I've been to one practitioner, another
Yep.
practitioner, another practitioner, another practitioner. And I think some of this is because you have to have a systematic approach. Like you can't just listen to sort of, even this is like, we're talking about histamine. We're not saying that's your problem, right? We're just saying
Correct.
this is another piece of the puzzle. And so you have to be able to work with somebody that can help you to figure out where is your body at right now, where is that feedback loop, because if you get stuck in a cycle and you just think probiotics are the answer, you just think this, that, or the other the answer, um you could get worse, right? And then you feel like, then what do I do? Well, then I go to another person, and they can't figure it out. And so it's important that we start. For us, we test, we don't guess. And I think you do kind of the same kind of thing, right? We want to see where the body's at in terms of deficiencies and toxicities, infections, right? Those three things, and kind of make a game plan that to work with the body. And even then, Justin, you and I have talked a lot about this. We work with people, and a curveball gets thrown our way, and we've even got to figure that out with them, right? Because the body's, I mean, God's made our body in a brilliant way. It's a
Yep.
lot smarter than any practitioner is in general.
100%. 100%. And I always like to compare and contrast conventional medicine to what we do on the functional medicine side, right? So conventional medicine sees your histamine issue. They're very rarely going to look at your diet. They're very going to really look at gut. They'll very rarely look at dysbiosis. They'll very rarely even look at the probiotic intolerance you're having, the probiotic side effects, and say why.
Mm-hmm.
They'll almost always will not look at mold, for instance. They won't look at mold issues. I could tell you, I have a patient. Patient reached out to Mayo Clinic. Okay. Mayo Clinic had him fill out the intake, right? This is Mayo Clinic in Rochester, Minnesota. And they filled out a questionnaire. And in the questionnaire, he brought up potential mold issues. Mayo called him back and said, we cannot treat anyone that brings up the word mold at all. So the most prestigious clinic in the world, Mayo Clinic,
Wow.
won't even touch you if you even bring up mold. He didn't even know if mold was the thing. He's just saying, hey, there's maybe, here's why. And they were like, nope, we're done. We can't even see you. So this is, and I just say it because we talk about treatment options. Conventional medicine a lot of times won't even touch you with a 10-foot pole. And that's sad because these people have root underlying issues and they need help. And what do we do about it, right? Now, your conventional approach will be H1, H2 blockers, right? So this will be like loratadine.
Histamine blockers.
This will be like your Benadryl, right? Then you have your H2 blockers, right? These are your histamine. These are going to be more like your Pepcid AC, kind of more your digestive reflux, famotidine kind of issues. And then we have like your mast cell stabilizers. These are going to be like your cromolyn, right? Your cromolyn. These are going to be more on the drug side. And then you're going to have leukotriene modifiers. These are going to be your montelukast. And then we go into steroids, right? Corticosteroids. Then we go into our anaphylaxis, like our EpiPens. And then we go into like Gleevec, which is our tyrosine kinase inhibitors. And then we go into like Humira, like our biologics. Like that's kind of the tree, right?
Yeah.
H1 blockers to H2 to mast cell stabilizers. Those are the big kind of drugs that are kind of in the chemotherapy realm. Then our leukotriene, our corticosteroids, EpiPens, tyrosine kinase, and then that's it. And our biologics. That's it. That's all we have.